Hey everybody, Jill here. It is National Puppy Day, so thank you for joining us. We are going to hang tight for 3 or 4 or 5 minutes, just waiting for folks to jump on so you can join us. So maybe you weren't able to make it in, or maybe you're out running errands and you have a quick second to catch some of our snippets. Dr. Grant from Advanced Animal Chiropractic is here first up today, so he's got top 10 chiropractic support list for your puppy. So I know we actually had a couple in last night, and they were going to look at puppies today. So fingers crossed that they found the right one, and they'll be back in to pick up some of the things for their puppies. So we'll just hold tight for a couple minutes, Dr. Grant, and then I will give you the go ahead. Got a couple people watching. If you're there, let us know who you are. Say hello. Let us, if you have any questions throughout the presentation, let us know as well. We'll make sure we get them answered. Right, Grant?
We can do that.
Awesome.
Make them easy.
Yeah, don't worry about that one. See if we'll go to the shelf and back over there too. This will actually go.
All right, and then just before Grant gets started, if you weren't able to see our live video this morning, just so you know, we do have our new puppy sheets. So if you have added a new family member, puppy or kitten, we're working on our kitten ones, but this is a welcome to the family 20% off. So you have to choose 6 different options here from our puppy sheet, but you can come in, you can bring your puppy with you, or you can bring your adoptive paperwork. We will also allow this for maybe a new family member, so maybe you grabbed awesome shelter pet that's older than being a puppy, so maybe a year or 2 or 5. And if you need supplies, you can come in, and as long as you buy 6 of the items in one transaction, we'll also give you 20% off. So first up, we have Dr. Grant, and then at 1 o'clock we'll have Lindsay here from Einstein, and then at 2 o'clock I will be doing one on nutrition. So we will have a live feed for each of the presentations. And let's see if these folks are joining us, so we'll get ready. All right, Grant. Got a couple people watching, so why don't we start?
Okay.
We got a couple people in the audience too.
Sure. So,
big old aliens.
So I'm Dr. Grant. I work with Advanced Animal Chiropractic.
Just speak a little bit louder for everyone so they can hear.
A lot of you also know Dr. Christina, who is my fiance and business partner. Either way, I am here to give a presentation on puppies. Me and Lewis had a very pretty good discussion on puppies and chiropractic care. I want to say Wednesday morning. It was a live video, so if you haven't seen that yet, you can definitely check that out by going to the Pet Bistro's Facebook page, checking out their video section. I'm sure at some point it'll make its way onto YouTube. Long story, I'll give you kind of the nuts and bolts of that discussion, but more or less what the discussion was about was how puppies, they benefit from chiropractic care from a developmental fashion. There's an expression I really like. It goes, as the twig bends, so grows the tree. So what that kind of says is that if something is growing improperly at an early age, it'll continue to develop that way as we get older in life. And as many of us know, our puppies are crazy. They run around, they play hard, they do some insane things. The nice thing about them is they're also very malleable and flexible, so a lot of times it doesn't look like they're necessarily doing anything. And the thing is, they may not even be creating that much damage, but what's nice about animal chiropractic is that I can feel the spine, figure out if there is anything going on, a little correction, a little adjustment. It's super gentle, it's typically no cracking or popping, and then we're kind of on our way. We usually recommend probably somebody who wants to start preventative care, probably once the pup is 3 or 4 months old, unless they're showing symptoms. And then if they're healthy, we just probably check them every 3-4 months to make sure everything is moving as it should. Because if you have a stable spine, you have a stable foundation to your body, and then that'll allow your pup to kind of age well. And some of the big things that we see later in life are arthritis, kind of, I mean, not just congenital, but certain things early on. If you start this kind of preventative stuff early, you know, the animal might benefit, you know, 5, 6, 7, 8, you know, as they're getting into their senior years too. So, what's the expression? An ounce of prevention is worth a pound of medicine. I forget, but y'all get what I'm going after. Anyway, so we have some top 10 tips today to support for chiropractic support in conjunction. So these things we do in conjunction with adjustments to help the puppy. One is to feed a species appropriate in a high quality diet. That is probably true, honestly, among any age, but the reality is when you're growing, you need all the nutrients you can find to help you grow appropriately. So lacking things early in life can obviously affect them later down the road. Another tip is to introduce your pup to new experiences frequently and in a safe manner. So socializing is big. If they don't ever have a chance to get out there and meet basically experience new things as they are younger, they might be terrified of it later in life, or maybe doesn't ever socialize properly, and you can kind of see that in certain dogs later in life. Another one, socialize to build for your pup to build confidence. That's just one thing. If a puppy is not used to seeing other animals or has bad experience with other ones, it can kind of stunt their behavioral growth. And then obviously, depending on how they're doing, can also affect their structural growth, although that's completely separate, and that's kind of the structural side, what we take care of. Training is imperative at a young age to keep the mind busy, so teaching them even just like basic tricks, you know, sit, stand, certain things like that. It's easier to teach a younger dog, tricks than older dogs. There's even an expression for that, but that way when they're have all this energy and a wandering mind, you can kind of put that energy to good use. 6, chew toys are a must. They keep teeth and help keep your teeth clean, and they save your shoes. That is certainly a true thing. We've gone through many a pair of shoes with our pups, socks, and quite frankly anything else they can get their teeth onto, but that'll help sometimes with teething. They're just experiencing a little bit of discomfort, so a chew toy can certainly help there. Another tip, chiropractic care from a young age helps during development. So that's something I went over earlier. You know, the spine is, in all animals, is really the foundation of the body. So if you keep that stable, keep those joints moving well, then your pup should hopefully develop properly and with less issues from a structural standpoint later in life. And as we all know, structure determines function, so, well, maybe we don't all know that. But if you have an unstable structure, you know, you're not going to have the muscle that's connected to that particular area of the spine function correctly. You'll get some inflammation, affect some of the nerves and things like that. That's why a lot of show and athletic dogs like to come see us, even the younger ones, just because they see the improvement in their performance, their gait, after an adjustment. Another tip, frequent naps and rest periods to both process training and allow the body to heal. So the puppy a lot of times, I think, will take care of the nap portion on their own, but it's a critical time for them to obviously recoup some energy, but also if they, especially after a training session, it gives them a chance for the brain to process and see kind of what just, you know, kind of try to learn, basically learn, process what they just learned, so maybe they can store that and use it again later. Introduce a variety of proteins and foods to your pet to help prevent allergies down the road. With our dogs, we cycle through different proteins. It's just something we've always done, and at least in the human world before we translated it over the dogs, if you give the same thing over and over, from what I learned in the human side, is that sometimes you can develop an allergy to it over time. And then start joint supplementation young. The things we recommend, so obviously glucosamine, chondroitin, MSM, hyaluronic acid are all critical. Hyaluronic acid is more on the intervertebral disc side, so if maybe you have a breed that's predisposed to disc injuries, so usually if it's little and white and likes to jump up and down on furniture. A dachshund, we see French bulldogs, but a lot of the ones that end up with back injuries. A supplement with glucosamine and hyaluronic acid will certainly be beneficial. We also like fish oil as well. It's got a lot of healthy fatty acids, so it's an anti-inflammatory, In addition to that, your body needs fats. In fact, your brain and your spinal cord, your brain's predominantly fat, and your spinal cord and nerves are surrounded by fat. So certainly another good supplement as well. And then depending on if your puppy is going through something, a natural anti-inflammatory like yucca root, turmeric, depending on how the severity, possibly even like some CBD or something along those lines, can be beneficial as well. Then I've got here the bonus, the other pet tip: snuggles, snuggles, and more snuggles, so they know they're loved. So in case you weren't snuggling your pup enough, that's your bonus tip. So outside of that, those are my 10 tips to support chiropractic care. Like I said, if you're interested in learning more about animal chiropractic care in general, or specifically with respect to puppies, you can go to the video Lewis and I did on Wednesday. It was a Facebook Live. It's in their video section. You can ask questions there. There should be some answers for you. You can call us directly at 248-602-0807 if you have questions. You can email us at advancedanimalchiropractic@gmail.com if you have questions. And then there's a hand up.
How much do the appointments cost?
So this is a good question. So the initial visit takes a little bit more time. We do a history. There's not as much history with the puppy typically. A little bit of posture, gait analysis, and adjustment. Runs roughly 20 to 30 minutes depending on the severity of the case. That's $85. Follow-up visits are $50. And as I mentioned previously, puppies tend, especially healthy puppies, which is the majority of puppies, they tend to be able to go like 3 months in between just kind of regular checkups. And usually as long as they're healthy, you can continue that for a number of years depending on the breed and what's going on.
So we have an online question.
Yes,
Lisa is asking if you or Dr. Christina would accompany people interested in picking up a puppy to give it a once-over prior to maybe buying or adopting, so that maybe you guys could give a new pet owner, new puppy owner, an idea of maybe if they're dealing with structural issues from the beginning.
Sure. I mean, I don't know if you're asking directly for us to go with you to set adoption or rescue, but if somebody were to get a new animal and they wanted to bring them in, we're here at the Pet Bistro frequently, Tuesday evenings, Wednesday afternoons, Thursday evenings, 2 Saturdays a month. We'd be happy to kind of do a look over and just kind of see if there's anything in particular going on. Usually with puppies, you'll see, I mean, there's usually if there's something bad going on, there's some pretty hard muscle spasms. So that is certainly something we could do if people were interested.
And I think that might be a case-by-case basis, too, depending on if the rescue or the breeder is local or not local. So that might be
a couple of factors, but it's not a bad idea, just to make sure there's nothing severe going on. But truth be told, in most puppies, there's not any...
Yeah, unless there's a birth defect
like a major birth. And I've seen a few cases where they've had some spine defects that were creating some neurological issues. But
so are there breeds that are more prone to needing chiropractic care out of from puppyhood? So I know like some of our, like I had greyhounds and they always end up with a very elongated spine sometimes, and they're fast racers. So, or some of our bully breeds that.
I would say, so bulldogs, they, especially like the English bulldog, I believe in particular, they have a lot of issues. So usually if it's a bulldog breed, probably not a bad idea to start early. If it's something like a dachshund or miniature dachshund, they're predisposed to back problems. I think it's like 25% will experience some type of obvious back injury during their lifetime, which means there's another 50% that's probably experiencing it, just not showing as many overt signs. That's probably a pretty good breed. I'd say any breed predisposed to hip dysplasia.
Yeah, your shepherds or some of your large breeds.
Yeah, shepherds actually is a good one because we see a lot of shepherds. Certain labs, things like that. Although it's kind of hard to adjust a puppy lab sometimes, especially if it's chocolate. We sweat a lot working with them. But that way, if they are predisposed to dysplasia, as long as we keep those joints moving well, it should hopefully take tension off of the joint, the injured joint. But I'd say those are the predominant ones. I guess maybe if a breed's predisposed to patellar luxation as well.
Okay.
It might help early on. But yeah, those are probably the predominant breeds from a preventative standpoint to kind of get started early.
Sure.
And if you have like a large breed, I guess like a Great Dane or a
giant breed,
then it's probably not a bad idea too, because 1 year in their life is different than 1 year in another dog's life. So I'd say those are probably the breeds to kind of go with.
Good.
As far as starting early.
Good. Got some other questions?
Can you talk about the spinal health is associated with ear infections?
Sure. So in the human world, chiropractic in the upper neck is associated with ear infections and things like that. So again, we'll talk human anatomy here, but when you get top bone's called the atlas. It has the most mobility typically in the spine. It rotates, and they believe in humans if it rotates at a certain way, it can kink one of the canals, draining fluid away from the ear, and then you get ear infections. Similar concepts apply with animals. So we've had a lot of chronic ear infection cases in puppies. I'm glad you brought that up because that's another thing we see in puppies, that they're not responding to medication necessarily or anything else, and sometimes when we go to check them, it's just really restricted in the upper neck. That atlas bone that likes to rotate, and if we take care of that, and some other motions to it there, but if we take care of that, a lot of times we start to see improvement with the chronic ear infection. What's also nice about it too with animals, especially puppies, is you pretty much know within a couple of visits how effective it's going to be or not be for whichever condition you brought it in for. So typically an ear infection, if it's going to respond well to care, clears up pretty well within a couple of visits. But yeah, great question, because we do see a lot of puppies with chronic ear infections.
Good. But another question?
Yeah, I know it depends on breed, but on average, when would the first time like to bring the dog in? Just
Sure.
For like
For the
first time?
visit?
Yeah, just for
Yeah,
first time.
first visit.
Just even if there's nothing wrong,
Yeah.
you could maybe
I
see
think-
something that is maybe occurring. That
Sure.
You
I kind of think between 3 to 6 months.
3 to 6 months, okay.
Yeah, I mean, unless it's like younger. We've seen a few younger than 3 months, but they were showing symptoms, signs. Like,
yeah,
so it's
right.
like-
But just
then
even
it's a little
just
bit
on
different.
average, it'd
Yeah.
be good to know that something you could help
Mhm.
prior to.
Yeah, I'd say a good window for a healthy puppy that's showing no symptoms or anything was probably 3 to 6 months. You know, you start them then, and then it's just you pop in every other 3 months. 4 times a year, just to make sure nothing is developing. Because animals don't show pain, they don't show weakness until it's pretty advanced.
Right.
So one nice thing about what we do is if it's going to be related to the spine, we get in there, we'll feel it before, like, oh, this joint's not
Yeah.
moving well. Oh, and a lot of times you'll see some obvious muscle spasm.
Right.
In the back too, it's a sign of discomfort. And so we'll point things out. I've had some cases today like that. I'm like, oh, do you know this arching here? Oh, no, I didn't. You go to it and you see the back light up. And they're like, I wouldn't have even known because the dog's still jumping,
Right.
up and down off of everything. So a lot of times, by the time they're showing an injury or something, it's usually
Yeah.
pretty well developed. It's not
Yeah.
like it just happened.
And like a human, if you can help them before they would need
Sure.
surgery, you know what I'm saying? If you could help them and
Yeah, from a
go on.
preventive, and the big difference too is we can't speak with our animals. At least I can't.
I know.
But humans, your back feels locked up, your neck
Yeah.
feels a little tight. You just pop into
Right.
the chiropractor. I think if most animals could talk, they would say, especially once we're getting
That would
even to
help,
the
yeah.
middle ears or some of the lot, they'd be like, this is affecting. Can we go see the animal chiropractor? But unfortunately, we can't. Some can, but I can't. So, yeah, I would say 3 to 6 months. Is
Okay,
probably
thank you. Appreciate it.
a pretty
Can
good time frame.
you talk a little bit about too? Sometimes that 3 to 6 month mark is when you're doing a lot of training, and so there's a
Sure.
lot of pulling
Sure.
on the leash because you're trying to get your puppy to understand loose
Command-
leash
yeah.
walking
Yeah.
and commands.
So that's a good point as well. So a lot's going on during that time frame. I mean, one, if it's a puppy, it's probably playing pretty hard. And if you take them to daycare to burn energy, they're definitely doing something to themselves because they play pretty hard there. But yeah, if you're doing training, if you're doing collar training, you have to give a correction every once in a while. It's going to put some tension in the neck. Depending on kind of what you're doing, there's some other added stresses in life you might not be thinking about, but for sure training can be stressful. I think really with puppies, just playing with other puppies is, based on what
Yeah.
I've seen, and especially if you have a dog that goes to daycare and they're pretty active at daycare, because our dogs always come back they're exhausted, but also there's certain things going on just because they play hard, it's a good way to burn energy, but it's also, you're going to stress the spine in certain situations. So yeah, from a preventative standpoint, with things going on with training, chiropractic care is pretty good. And I would say this, it's in the human world, I like to bring it back to that because most people are familiar with chiropractic for humans. Some people bring their babies in the day after they're born to go see the chiropractor, and come in with some type of regularity. So it's this concept isn't too abnormal. This whole practice is in the human world that's specialized or focus on these pediatric cases from when they're an infant. So I think the difference again is just that puppies just don't tend to need as much care in general. So
Sure.
yeah.
So we had another question from Lisa. She wants to know if chiropractic can help with dental issues, or is that primarily poor choices in nutrition?
So, if I had to guess, I'd say it's predominantly poor choices in nutrition. However, if you have a TMJ issue, maybe you're getting some abnormal wear on some of the teeth, leading to some dental issues. So we do adjust TMJs, we adjust back legs, front legs, we adjust as many joints as there are. So I'd say the predominant's going to be nutrition, but you can get some abnormal wear if one of the temporomandibular joints is not really motioning the way it should. So, and then I can bring it back to the human world. You can see grinding on the teeth and things like that with people that have TMJ issues. So I would imagine it's no different than with dogs.
So a couple, I know, just out of like some of the, just to kind of circle back around with that, I know Dr. Cole is working on a young pup right now who has actually an overbite.
Okay.
So we're trying to see if that corrects it. So that's a different like mouth structural issue that Dr. Cole's working on right now with a client of ours.
Yeah, and yeah, I mean,
that puppy's 12 weeks old, so it's something early.
Pretty young, yeah. No, I think like I said, if the TMJ is not moving well, even if parts of the upper neck aren't moving well, it can affect what's going on with the teeth. So I'd still lean towards, depending on what kind of dental question you're asking, most are probably nutrition related, but there are certainly some cases, like I said, with abnormal wear and tear, something along those lines, that could be a result of some TMJ issues.
Perfect. Mm-hmm. Any other questions? Do you want to see if Alex is willing to show some stretches for folks, or some things they can use with puppies?
Yeah, so these are most dogs are food motivated, which is a nice problem to have.
Right. Do you feel comfortable with him up there, Ashley?
Yeah.
Okay.
Hey, buddy. Yeah, he goes, I'm a show guy.
I'm used to being on the table.
Yeah. So one thing we do, and it actually works with older dogs too, but you can start kind of preventative standpoint.
Yeah.
As we are aging, they're called cookie stretches. They are called cookie stretches because they involve a cookie and stretching. So what we do, you can stretch the neck, you can stretch the back legs, you can kind of stretch everything up. What you do is you take a cookie, and he's tracking it pretty good. So first I'll bring Alex, hey buddy. You bring it to the right shoulder. You okay, dude? You nervous? Oh, he's drooling, so he definitely wants it. So you bring it there. Alex, ready? Follow this way. Follow this way, buddy. Oh, yeah. Oh, almost there. If you look at here,
do we need a stinkier treat, maybe?
Maybe we need to reward him first. There you go. Yeah, now it's in.
Yeah, right. Now we're talking.
Uh-oh.
Whoop.
All right, buddy. So you would take it to the right shoulder, and you can take it to the left shoulder. Good job, buddy. Can you still track that? Good, man. All right, ready? Can you track it to your chest? There you go. And then you can have them track it above their head. Hey, dude. Whoa. He's just kind of, there we go. And that kind of works the neck. And then if you really want to get the back, a lot of times you get up there standing. But hey, Alex, you have them track it to their hip. Ready? Come get it. All the way. He's like, well, no, I'm standing on a table right now, and I'm concerned I'm going to fall off.
I know.
But yeah, buddy, we'll try one more time. Ready? Come get it. Can you follow it? Oh, he's looking at this one here. See, they're both here. Can you come get it?
You're like a magician.
It says I eat raw food.
Yeah, I don't know about those snacks.
All right, dude.
But the concept, that's cool. I like that.
Yeah, the whole concept, though, is it would be shoulder to shoulder, tuck it, extend, and then you could bring it to the hip. So if I'm a dog, I'm going all the way back to this hip, trying to catch it, and then you hold it there for a second, and then the same thing going the other direction.
Maybe a couple of those smelly treats will do the job.
All right, dude, you ready? And you might even.
Actually, how often do that every day, or?
You can just do it. I mean, you can do it every day if you want. If you want to make them work for a treat, why not? It's not going to hurt anything. So, all right, buddy, you ready? Ready to track these? And if not, I might have him track it from you.
Yeah.
Ready? Let's go get it. Oh, that didn't help. Ready? Come get it. Yeah, so usually he should be able to get a bit more. I think because he's standing on a table, he's probably a little concerned if he has to get.
He's like, I'm used to getting groomed.
Be able to bring the nose pretty close to the back side here, and then you kind of bring it around here, and you just hold it for like 2-3 seconds. We'll give you a reward. You're a good participant here. But yeah, back right hip, back left hip. tucked to the chin, so they'll kind of come down like this. You can have them extend above. And then if a lot of certain breeds, like little beagles, a lot of the smaller kind of white breeds end up with like neck issues. And then you can focus, instead of bringing to the cookies to the hips, you can bring it to the shoulders and things like that. But yeah, basically as long as they're food motivated, just make them work for it and just bring around certain areas. We actually recommend these a lot with older dogs too. Helps keep the spine range of motion good, but it's one of those things that if you do it from an early age, it can help. There we go, yeah, there we go, yeah, you're kind of getting right
there we go.
But yeah, from an early age, it can be kind of preventative too. Stretching's a good thing. I should probably do it more than I do, but yeah, that would be my best like kind of basic tip for stretches with the puppy and things like that. Really for spine range of motion, that's probably all you really need to think about. I mean, at a younger age versus some of the rehab exercises or anything like that, because most of them don't need it yet, that type of stuff.
So they wouldn't. You don't think they would need like core exercises or anything?
You know, it depends on they shouldn't. So it just depends. Okay, do they have a problem? If we have back problems, then yeah, I would recommend a core exercise. If they're just coming in a healthy dog that I'm not finding too much, just a regular visit, no, they just one spot in the hip was off, probably not needing a core strengthening exercise. But yeah, if I'm going through, like I know we've had some back issues with him before, it might not be a bad idea to do some core strengthening exercises. But I'd say for the majority of puppies, stretching would probably be bigger than like a core strengthening exercise. So, although it is becoming beach weather, so maybe they do need to do a few more core exercises. But yeah.
Good.
Any other questions?
We don't have any other questions online, unless anyone here has any questions. Jenny, anything?
Great.
All right,
Very
so
informative, yeah.
if you could maybe just give us a quick last, we got the price, the cost of the consults. It's $85 for initials, $50 for follow-ups, and then when are you and Dr. Cole here so everyone knows?
So Dr. Cole is here Tuesday evenings from 4 to 8:20, roughly 8:20, depending on what's going on. I'm here Wednesdays 10 to 1, Thursdays 4 to 7. We are here 2 Saturdays typically a month.
Yeah, there's always appointments, so people can call, and if,
yeah, you can usually get in
same week.
within the week, yeah.
Yep.
Same week. One day might be pretty busy, but there's usually another opportunity.
Perfect.
Other days along those lines.
Fantastic.
But yeah.
Anything else you can think of that we need to know for puppies?
Thought about it. You know, one of the other year.
It's out in the parking lot.
Yeah, you know, one of the nice things about the Pet Bistro is that if you are, I think it's a member of the loyalty membership.
Yep.
So, you know, one of the benefits of starting at an early age, the program started this year, that after the 11th?
By 12, get one free.
At the 12th visit, you get your next visit
Your
free,
13th
so.
would
So
be free.
it might take, you know, if you have a healthy dog, it might take a couple of years to get it, but
Yeah.
you know, from a that's a nice little perk for the program we do at this location. And if you start early with the puppy, then yeah, certainly get there. But that would probably be my only other kind of addition.
Perfect.
So
Well, thank you for your time today.
Yeah,
Thank you.
Yeah.
thank you.
And if anyone has any questions, they can add them in the comments, and we will circle back around. Either Dr. Grant or myself, Jill, will go in and answer them.
Cool.
Thank you.
Thanks for your time.